Hi, I'm Irma Botvin. I'm here with Dr. Larry Berkelhammer. Dr. Berkelhammer has researched mindfulness practices to increase mastery in well-being.
I'm curious because I saw on your website that you talk about curiosity, and I'd like to hear about it.
Yeah. Curiosity. I know there's an expression, curiosity killed the cat. Mm-hmm. Well, I don't know anything about cat health, but with people, curiosity is important to health and happiness. You can't have mastery and well-being without curiosity. Think of what it's like for people who live with depression. The curiosity is gone. Curiosity is part of being, what gets us up in the morning. Why do we want to get out of bed in the morning and get on with our day? It's because, I'm really curious. What's going to happen today? I mean, if we knew with absolute certainty every single thing that was going to happen during the day, we'd lose our curiosity. We would die of boredom. Think of clinical researchers. Now, a lot of people call up an image of someone going to work every day in a lab. Oh. People who work in research, basic research in particular, they, not just basic research, researchers looking to find if a certain drug works. It's the curiosity. They want to know, is this going to work? What am I going to discover today? That curiosity drives them. It's powerful.
It is important, actually, if you have some kind of ailment, to be curious about what you might do about it, who you might ask about it.
It's important to be curious about what you have, to learn more about it, and not just rely on your doctors. Mindfulness practice fosters curiosity. The way it does this is when you're practicing mindfulness, you're tuning into, what are my thoughts? You're following your thoughts, curious about them. What are my sensations? Tuning into being curious about your sensations. When you're engaged in an activity, instead of being attached to the outcome, you want to be curious. Where is this going to go? So you may have assumptions that you know, but we never really know. And it's important to have a healthy curiosity.
Well, I've heard people, I know a lot of people do a lot of research on the internet about their medical symptoms, and then when they go to the doctor, they bring numerous pages of information, and I don't know how that goes over
And a lot of old-fashioned doctors are still offended by that, but most of the newer doctors, they want the patients to take charge. They want the patients to be proactive. If a patient brings in some new information, a really good doctor is going to take that and look at that information, because actually a lot of patients bring information to the doctor that the doctor may not have had. It's the patient's curiosity that may improve their health. And hopefully you're going to doctors who have curiosity. You want to go to doctors who have curiosity.
Well, that's a good point. That's a very good point. Okay.
Yeah.
Okay. Well, thank you. I think you've resolved some of my curiosity about the subject.
Good.
Okay.